Blood donation is extremely important as it saves lives. In Nigeria, the National Blood Transfusion Service, NBTS, an agency under the Federal Ministry of Health this Monday in Abuja, celebrated two Nigerians, a male and a female, for being the highest blood donors in the country, describing them as nation's hero and heroine in promoting public awareness on the blood donation campaign. The honor done them is part of activities to mark this year's World Blood Donor Day in Nigeria. Our correspondent Mesieke now tells us more.
World Blood Donor Day, an initiative of the World Health Organization, is celebrated on June 14th every year. The objective of the annual celebration is to spread awareness on the significance of blood donation and to recognize the contribution of voluntary unpaid blood donors in saving lives. At a news briefing to mark this year's event, two outstanding Nigerians who had been consistent in donating blood to save lives were recognized and honored for their sense of patriotism. They are Nathan Akman, who has donated blood for 67 times, and Hajara Issa, who has donated blood for 17 times. Commenting on the theme, "Give blood and keep the world beaten," the Minister of Health, Dr. Osage Ihenime, said the theme of this year's campaign is aimed at encouraging voluntary unpaid donations as the life wire of mankind. Noting that blood is the life-giving fluid that delivers oxygen to the cells of the blood, Ihenime said the adequate supply of the blood product helps to reduce the mortality associated with life-threatening diseases, bleeding in pregnant women, and lots more.
The theme of this year's campaign is aimed at the very essence of voluntary unpaid blood donation. As the life wire of mankind, it is important that we have adequate supply of blood and blood products to meet this increasing demand. This will help substantially to reduce the mortality associated with life-threatening diseases, trauma cases such as victims of road crashes, casualties of bomb blasts, anemia in children, bleeding in pregnancy and delivery, victims of insurgency, conflict, and building collapse, to mention just a few.
The National Coordinator, NBTS, Dr. O.J. Amedu, said World Blood Donor Day is designed to appreciate all the blood donors across the world and to call on the government to encourage and support the health sector with more funding.
As a gynecologist, I must mention that the commonest cause of death in women who deliver is postpartum hemorrhage, and we do not have blood enough. People are reluctant to donate. I do not know why.
Also, Dr. Walter Enubong of WHO said there are millions out there who need blood and commended the NBTS for its 10-year strategic blood plan. He urged the young and healthy to donate to save lives.
This day is also an opportunity to thank and appreciate voluntary, unpaid blood donors for this life-saving gift. Safe blood and its transfusion are key aspects in providing quality care to save mothers hemorrhaging during childbirth.
The Nigerian Medical Association, NMA, however, says over 90% of blood donated are contaminated and called for blood to be replenished, as injury to one is injury to all. The NMA said the message of save blood saves lives should keep spreading. The World Blood Donor Day was first observed by WHO in 2004. It was declared as an annual global event in the 58th World Health Assembly in 2005. The day is equally celebrated to mark the birthday of Australian biologist and physician Carl Landsteiner, also known as the founder. Mercy Eke, reporting for Clearview Television.